Hello and welcome back to my channel. Today we're going to talk about a topic that's been gaining a lot of attention recently: intermittent fasting and its effects on hypertension, or high blood pressure. Hypertension is one of the most common health conditions worldwide and is a leading risk factor for heart disease, stroke, and kidney problems. Managing blood pressure effectively is essential for long-term health, and many people are curious whether intermittent fasting can help lower blood pressure and improve cardiovascular health. In this video, we'll explore what intermittent fasting is, how it might affect blood pressure, the potential benefits and risks, and what you need to consider if you're thinking about trying intermittent fasting to manage hypertension. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. First, let's start with a brief explanation of what intermittent fasting is. Intermittent fasting is an eating pattern that cycles between periods of eating and fasting. Unlike traditional diets that focus on what you eat, intermittent fasting emphasizes when you eat. Some of the most popular forms of intermittent fasting include the 16-8 method, where you fast for 16 hours and eat during an 8-hour window, and the 5-2 method, where you eat normally for 5 days of the week and drastically reduce your caloric intake on 2 non-consecutive days. During the fasting period, the body shifts from using glucose as its primary energy source to burning stored fat. This shift can lead to various metabolic changes which may have effects on blood pressure, insulin levels, and inflammation. Let's talk specifically about how these changes might affect hypertension. Hypertension occurs when the force of blood against the walls and the arteries is consistently too high. Blood pressure is measured in 2 numbers: systolic pressure, the pressure when the heart beats, and diastolic pressure, the pressure when the heart is at rest. A normal blood pressure reading is typically around 120/80. When blood pressure rises above 130/80, it's classified as hypertension. If left uncontrolled, high blood pressure can damage the blood vessels, increasing the risk of heart disease, stroke, and other complications. So, how might intermittent fasting influence blood pressure? One of the key factors is weight loss. Excess weight is a significant contributor to hypertension, and losing weight can help reduce the strain on the heart and blood vessels, leading to lower blood pressure. Intermittent fasting can promote weight loss by creating a caloric deficit. When you restrict the hours during which you eat, you may naturally consume fewer calories. Several studies have shown that intermittent fasting can lead to modest but significant weight loss, which in turn can lower blood pressure. But intermittent fasting may also affect blood pressure through other mechanisms that go beyond just weight loss. During fasting periods, the body experiences changes in several key hormones that influence blood pressure regulation. For example, intermittent fasting can lead to a reduction in insulin levels. Insulin is the hormone that helps regulate blood sugar, and when levels are consistently high, something common in people with insulin resistance or type 2 diabetes, it can contribute to the high blood pressure. By improving insulin sensitivity and lowering insulin levels, intermittent fasting may help reduce blood pressure in people with insulin resistance. Another factor is inflammation. Chronic inflammation is thought to play a role in the development of hypertension, and intermittent fasting has been shown in some studies to reduce markers of inflammation. By reducing inflammation, intermittent fasting may help improve blood vessel function and reduce blood pressure. Additionally, intermittent fasting may increase the production of nitric oxide, a molecule that helps relax and widen blood vessels, improving blood flow and potentially lowering blood pressure. One interesting study published in 2020 examined the effects of intermittent fasting on blood pressure and cardiovascular health. The researchers found that people who followed intermittent fasting had lower blood pressure, reduced insulin resistance, and improvements in cholesterol profiles. These effects are promising, especially for people with hypertension, as they suggest that intermittent fasting may offer cardiovascular benefits beyond weight loss. That said, while intermittent fasting may offer potential benefits for managing blood pressure, it's important to understand that it's not a magic solution, and there are risks and challenges to consider. One of the main concerns with intermittent fasting and hypertension is the risk of dehydration. During the fasting periods, people may unintentionally drink less water or forget to stay hydrated. Dehydration can cause blood pressure to rise because the body retains more sodium when it's dehydrated, leading to higher blood pressure. If you're considering intermittent fasting and have hypertension, it's crucial to stay hydrated throughout the day, even during fasting periods, to avoid dehydration and its potential effects on your blood pressure. Another issue to consider is the potential for stress on the body. While intermittent fasting can help reduce oxidative stress in the long term, fasting can initially cause the body to release stress hormones like cortisol and adrenaline. These hormones can raise blood pressure temporarily, particularly during the early stages of intermittent fasting. If you have hypertension, it's important to monitor how your body responds to fasting and be mindful of any increases in stress or anxiety. It's also important to consider the quality of the food you eat during your eating windows. While intermittent fasting may help with calorie restriction, it's not a free pass to eat unhealthy foods during the eating periods. Processed foods high in salt intake and excessive saturated fats can all raise blood pressure, even if you're following intermittent fasting. To maximize the benefits of intermittent fasting for blood pressure control, it's essential to focus on a heart-healthy diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats. If you're thinking about trying intermittent fasting to manage your hypertension, it's essential to consult with your doctor first. This is especially important if you're taking medications to control your blood pressure. Some medications, like diuretics, can increase the risk of dehydration during fasting, while others may require adjustments to ensure that the blood pressure remains stable. Your doctor can help you determine whether intermittent fasting is safe for you and guide you on how to monitor your blood pressure and make any necessary medication adjustments. In conclusion, intermittent fasting may offer potential benefits for people with hypertension, particularly through weight loss, improved insulin sensitivity, and reductions in inflammation. Some studies suggest that intermittent fasting can help lower blood pressure and improve cardiovascular health, but it's important to approach it with caution, especially if you have existing health conditions or are taking medications. Staying hydrated, monitoring your stress levels, and focusing on a heart-healthy diet during eating windows are all crucial steps to ensure that intermittent fasting is both safe and effective for managing your blood pressure. Thank you for watching. I hope this video provided valuable information about the effects of intermittent fasting on hypertension. If you have any questions or personal experiences with intermittent fasting and blood pressure, feel free to share them in the comments below. Don't forget to like this video and subscribe to the channel for more health-related content. As always, take care of yourself and make the most of your day.